Evolution of Glaucoma Surgeries, Trabeculectomy and Beyond by Dr. K. Subashini.
Good morning, everyone. So the topic of my presentation is evolution of glaucoma surgeries, TRAB and beyond. So for more than half a century ago, there has been a multitude of surgeries for uncontrolled glaucoma, but all of these were wrought with complications. The earliest being iridectomy, then the trifine operations you would have heard of, cyclodialysis with intraocular drainage, iridine lysis, then we have the Elliott's corneoscleral trifining. So all these are obsolete now. In 1968, Sir John Kearns, he developed the trabeculectomy technique. So it was based on the concept that the trab meshwork and the inner wall of the Schlemm's canal offered the maximum resistance to the aqueous outflow. And even before Kearns, it was Sugar who actually tried experimental trab on eye bank eyes. In fact, he was the one who coined the term trabeculectomy. So Kearns trabeculectomy he created, in this technique, he created a flap starting in the cornea 2 to 3 millimeter anterior to the limbus, and it was hinged on the sclera, and a deep scleral lamella containing the Schlemm's canal and the trab meshwork was excised, and then the flap was sutured. In 1975, Watson and Barnett, they modified Kearns' trabeculectomy, and this was called the sclerokeratectomy in Watson's technique. 5 by 5 scleral flap was hinged anteriorly, and a second full thickness corneoscleral flap containing the scleral spur and the trab meshwork was excised under the superficial flap. So currently, this is the technique that all of us follow, the sclerokeratectomy. And because of the main cause of failure of TRAB was the subconjunctival fibrosis, then there were techniques to modify and modulate the wound healing process. In that, 5FU was the first to be used, but mitomycin became more popular. For obvious reasons. Then beta radiation also was tried, corticosteroids, anti-VEGFs, amniotic membrane, ologen, and even modification of the suturing technique, use of releasable sutures and adjustable sutures and suture lysis. So, Dr. Peng T. Kaur, from Moofield's, he introduced the Moofield's safe surgery system, also called the enhanced trabeculectomy, because with the use of mitomycin, there were more complications like bleb leaks and polycystic blebs, dysaesthetic blebs. So, his concept was to have a large treatment area with mitomycin, and here the scleral flap also didn't reach up to the limbus, just 1 millimeter short of the limbus it stopped, and a single scleral punch sclerostomy. So the idea was to have a posteriorly directed flow.